All right, like I said, welcome. We are so glad to have you. This is kind of what we'll be talking about today. We'll talk about St. David's strategic plan, the funding opportunity itself, the scoring process, including LOI and rubric, and then we will get to the Q&A portion. And with that, I will pass it over to today's facilitators, two of our wonderful senior program officers, Abena Asante and Kim McPherson. I'll have them introduce themselves and then we can get going.
Thank you, Claire. Hello, everyone. Again, Abena Asante, and thank you so much for making time to be on this webinar this morning. I'm one of the senior program officers here at the Foundation, and I'm excited about the direction of the Kim?
Hello. Morning, everybody. I echo everything Abena said. It's great to see so many both familiar names and non-familiar names, and just eager to talk about this opportunity with you all and answer whatever questions we can. So looking forward to it, and thanks for making the time.
All right, so we have a new strategic plan that is guiding our work as a foundation called Pathways to Health Equity. It reflects a new way of working for St. David's Foundation. And as many of you know, this strategic plan went into effect last year. And the goal of the strategic plan to your right mentions three main goals. But what I want you to keep in your mind is that these goals are intersectional. So goal one increases access to quality care designed to advance health equity, which is a focus of the culturally responsive mental health support. Goal two focuses on removing the economic barrier to improve health outcomes. And goal three, which also intersects with the call under discussion today, is equipping communities to achieve their health. Our mission as a foundation is to advance health equity through investment in access. So our work centers health equity. We are focused on removing those barriers for a better living today and looking at changing systems in partnerships with our community and making those conditions better so that we can collectively improve outcomes for a healthier community tomorrow. So we listened a lot to our community members to come up with a strategic plan. So what does this mean? It means more funding opportunities that will be accessible to our entire community through an open and transparent process. For those of you who are familiar with St. David's Foundation, our past way to fund projects was via invitation only. We'll listen to the community, we heard you, and we've changed it. So these open calls allows us to open the potential funding opportunity to all eligible organizations. You don't have to know anybody here at St. David's Foundation, and we are also on this journey to learn with you, learn alongside you, with the goal of advancing health equity here in Central Texas. This work also means that we are going to work upstream, not only to address immediate barriers. So, as I reflected earlier, it's around helping to improve those conditions, helping to help change those systems so that we can improve outcomes for a healthier tomorrow for everyone.
Abena?
Yes.
We're working on it on the back end, but your mic is a little choppy. So when you're talking, if you can speak up and just really speak super clearly. And y'all, I'm really sorry. We'll see if we can get someone from our IT department to help. And in the meantime, Abena is going to use a big old outdoor voice. Ah, perfect. Hopefully that helps. We love technology.
Is it better? Or it's still choppy?
It sounds much better to me, and it sounds like from the chat, it's much better for everybody. Y'all did not see that, but that was our fabulous program officer, Michelle, coming to the rescue as she often does. So teamwork. Sorry about that, everybody.
We did work when we tested before, but for some reason,
Avin, are you able to? Nope. Are you there?
here.
Okay, great. You can resume.
Can you hear me?
Yep.
Is it better?
Turn it up a little bit. And if you like, would you like me to take over while you?
Yes.
Okay, y'all, so sorry about that, but luckily, I know what Abena was about to say. So Claire, so as she was saying, you may not have heard it, this graphic describes this foundation's new strategic plan. And I think the core message there is that the three goals that we have that you see are all in service to centering equity. And while this particular call is not specifically about the whole strategic plan, it's really grounded in the strategic plan. And so if you haven't had a chance to read it, you can find it on our website, and we definitely encourage you to take a look at it as you're thinking about this call. And then next slide. And then what we'd really like to do is many of you on this webinar probably in some way or the other helped us shape this call. We were really trying as we developed it to lean into what we heard from community about what is needed in terms of developing culturally responsive mental health supports. And so the call was informed both by 3 community conversations in our more rural counties where we know there's very sparse supports, as well as a whole lot of really, really helpful conversations one-on-one with people on the ground and working. So if you were one of those people that helped shape this, thank you. Many of you have probably helped shape it in ways just from past conversations. So hopefully as you look at the call, it resonates with your experiences. And we're continually open to feedback. So as you can probably tell, this is a bit of a new way of working for the foundation, and you'll see it exemplified in a lot of the goals we have in the plan, is to make sure that our resources are really connected to both what community needs and also what existing assets exist. We want to lean into those assets, try to grow them and leverage them. Next slide. Great. Well, now we're getting into it. So here's the funding overview. And I'm not going to read the slide, but I'm just going to emphasize a couple points. One, this again is related to what we heard from community. And a lot of that had to do with really trying to start with where community is and what it needs. And while we know there's clinical need, this call is really starting with non-clinical mental health supports. And it's really focused on what our marginalized neighbors are needing. And a focus here is to really create those supports from trusted organizations and people in really trusted spaces, and that are super consistent with people's culture, history. And so it's a little bit of a different one, different from what we funded in the past. But what we're hoping it will do is both serve as a bridge to clinical care and also really help inform our understanding of what exists in our communities and be a platform that as we move into the new strategic plan, we can really build on. Abena, give me the signal if you are back on and want to take over.
I think I'm back. Can you hear me?
You can maybe turn it up a little bit. Or I can keep going, you tell me.
Okay, can you hear me? Okay, keep going.
Yeah, sounds good.
Oh, I hear yes is good. Okay, good. So I'd like to take over. Kim, thank you so much. And again, I apologize for the technological difficulties. So for almost 30 years, St. David's Foundation has consistently invested in the mental health ecosystem in clinical and non-clinical mental health and well-being in Central Texas. Most of our clinical investments has been in the safety net clinics. And we've also invested in non-clinical mental health supports in community settings like the Libraries for Health Initiative, in schools, etc. So, and as Kim mentioned, this funding opportunity is focused on non-clinical mental health support. Why? Because we recognize the importance of clinical interventions like the diagnosis, treatment, therapy, etc. However, we also heard from community during the conversations that there's this historic stigma. They sometimes do not trust clinical settings. And we also want to be able to learn from you, the community, in terms of what is working so that we can help put a spotlight on it. So can you think to a place where you felt safe, you felt welcome, you felt supported, a place where you were accepted, non-judgmental, it was inclusive, it was welcoming, your faults wasn't deterring you, it was also a place where your assets could shine, and a place where you could gather, connect, and thrive with other community members. Have you ever been in a space where you could, there could be reflection, there could be healing, there could be connection, there could be purpose? So this call, as Kim alluded to, is focusing on non-clinical mental health support. So we seek to help increase the number of Central Texans from historically marginalized communities in our service area to receive culturally responsive mental health and well-being support that honor their racial and cultural identities in trusted spaces. We know from doing this work that these non-clinical mental health supports are translated and received differently by different groups. So it's important that community providers know their community and involve their community in shaping responses that tailor to the community's context. And so we are looking to support organizations looking at two main goals. So this funding opportunity is to help increase non-clinical mental health and well-being supports for historically marginalized communities. So we are looking at proposals or ideas of organizations that already are connected to their community. They know their community, they are trusted, and their spaces are accessible to community members, minimum barriers or no barriers. We are also looking as a second goal to increase the number of culturally responsive providers within community-based settings. So this is what we heard from community conversations. We heard that they were interested in having access to more community spaces that met them where they were as an individual, where they did not feel the stigma, where they could go in, feel a sense of belonging, go in to connect together, to learn, to support each other and thrive. Next slide, please. So what is this? What does the funding look like? So the award will be based on the proposed project that you tell us about. We'll also look at the organization's potential for impact through the delivery of the culturally responsive mental health support. There's more of this in the rubric, and Kim will also allude to that. We also look at the organization's annual budget to make determinations of the award amount. So this award is one time and it's flexible. One time meaning that there is no guarantee of continuation funding beyond the 2 years of this funding opportunity. And so be cognizant in how you use the funds and also the programming that you provide, because it's one time. Flexible means you can use the funds to align with the scope of work that you included in your proposal. It has to honor that scope of work. And so with flexible, as long as it's honoring that scope of work within the grantee agreement, that's fine. You can move things along different budget lines as long as it's meeting the original goal and intent of the funding. So how much money do we have for this call? We have $5 million across all grantees. And with this funding opportunity, we anticipate making funding awards between $50,000 and $250,000. We also do not have a minimum organizational budget requirement in order for an organization to apply. When it comes to reporting, we are doing a lot of trust-based philanthropy, and we don't want to burden our nonprofits with too much paperwork. So there will be annual grant reports, and there will be an opportunity to participate in biannual grantee cohort meetings. And awarded grantees could bring up to 2 individuals from the organizations. These grantee cohort meetings provides that space for us to learn alongside you, for you to share with each other, for you to receive training. And what we plan to do is when the grant is awarded, hear directly from the grantees so that these cohort meetings can be shaped in a way that is beneficial to you as well. Next slide, please. All right, so these are the key dates. Last week was when we opened the culturally responsive mental health support funding opportunity and the Healthy Birds, Healthy Communities funding opportunity. So please, we've started receiving letters of intent. And so we encourage you to please go ahead after you've thought it through to submit your letters of intent by 5 p.m. on July 28th. 5 p.m. is the magic time, not 11:59 p.m. If you're invited to submit a full proposal, that proposal will be due August 15th, again at 5 p.m. Around mid-September, the foundation leadership would make funding decisions with a goal of the project starting October 1 for the 2 years. Next slide, please. All right, Kelly, I think you're next.
Thank you, Abena. Well, everybody, Abena painted a really, I hope, clear picture of what we are trying to do in terms of this call. And my job is to go through the kind of wonky and not nearly as exciting, but very important details. So I'm going to talk a little bit about the LOI process, the rubric scoring, and then we'll turn it over to any Q&A that you have. So if you've got questions, just write them down and we'll make sure we get to them all at the end of this. First off, this is like you've probably seen us do. This is an open call. And an open call means that anybody who is eligible can apply. Occasionally we'll get people asking, hey, am I eligible for this? If you open the application and you read the eligibility criteria and you meet it, you are eligible, even if you're an existing grant partner. And so an important part of that open call is this step of the LOI or the letter of intent. So let me just give you a little bit of like the 101 on the LOIs. Open to everybody who meets eligibility. The whole goal of this is to allow any interested organization to describe their eligibility, describe their kind of idea or proposal at a very high level with a minimum amount of time required so that then we can give you a sense about whether it's in the zone. So small amount of time to fill out the LOI. It's going to vary, but if you know what it is that you are trying to propose, I think a good rule of thumb is it probably shouldn't take you more than a couple hours to submit the LOI once you know what it is that you're trying to do. Remember, you can submit any time before July 28th when they're due, as Abena said, at 5 p.m. But what's cool about the way we're doing it now is it's a rolling LOI. And so what that means is when you are ready to submit, there's no reason that you have to wait to the last minute. Go ahead and submit now. The advantage to that to you is we will give you a decision in about 5 business days. So that means if you submit early and you get your decision, you have longer to work on your application, assuming you're invited to submit a full application. So you can wait to the last minute, but unless there's a good reason to wait, it's honestly better for you to get it in earlier so you have more time. What else do I want to say about this? Oh, the other important thing to note is organizations can submit more than one LOI. So if you have 2 very distinctly different ideas, they don't make sense to merge. They're totally different budget, different scopes of work. You don't have to decide which one to submit. You can submit both. You are essentially kind of competing against yourself, but yes, you can submit both and that's fine. There's no judgment on this side. Submit both of them. They might both get funded. So existing grant partners can apply, turnaround of 5 days, early is better if you are ready, and you can submit multiples are the key things to know, and the deadline of July 28th. Next slide. Great. And this is really the LOI question. So this is what you're going to be answering when you do your LOI. And when we are looking at it, I just kind of want to explain what we're looking at. We're making sure that you do meet the eligibility criteria, that you truly are operating in Central Texas, that you're a 501c3, a government entity, a fiscal sponsor. But we're also looking at the proposed scope of work. And we're not doing a fine-tooth screen on it. We're just making sure that it's really in the zone of this call. So it's important to describe your project in a way that gives us enough visibility to answer that question. This is not a creative writing contest. We are not judging proposals by how beautifully they're written, the quality of the language. We just want visibility into what you're trying to do. So don't make it harder on yourself than it needs to be. There's no word limit, as we said. We're going to suggest that you aim for less than 500 pages, which is about 1 page single spaced. If you truly need more than that, go ahead and do it. But just know we're not looking for something particularly long, and about 1 page is a good rule of thumb. The other thing I want to mention is that the LOI is a really wide screen. So if you submit and are accepted to advance to a full application, it's just important to know what that means. It doesn't mean that you are like a shoo-in or that your proposal is highly likely to be funded. It just meant you met eligibility and that you're in the zone. So you guys know filling out a whole application takes a fair amount of time. So it's still something we suggest really think about whether this call is a good fit for the work that you're proposing and if it's worth putting in that amount of time. Last thing I want to say is that proposals do not have to be for new work. As Abena said, this is one-time funding. So it is perfectly fine. And frankly, we expect a lot of the proposals will be about existing work, strengthening that work, refining it, expanding it, but it does not have to be for brand new work. And in fact, if it is for brand new work, we're really hoping that organizations are asking themselves, how would I continue this or fund it when the grant is over? Because again, it's one-time funding. So what you're already doing, strengthening, refining, perfectly fine. Next slide. Great. So now we've moved on from LOI, and this is assume you've submitted your LOI and you got notice that it has been approved. And so now you're on to submitting your full application. This part of the call, you'll find this rubric in the call documents on page 5. It might not look super exciting, but this is super, super important. So you'll see it on page 5, and this really describes how we are going to be scoring your applications. There's not only this rubric that you see here, but in the pages following it, it really gives more detail on how we're scoring each of these components. So really read this and be familiar with it. One of the things that we suggest doing is go ahead and hand your draft proposal off to a colleague that maybe hasn't been super involved and ask them, say, pretend to be the foundation and score what we've written on this rubric. That's a really good indication about whether or not you've said everything you need to say to give yourself all the points that you're entitled to. So it's just a suggestion, but it can be really helpful. We've all been in a situation that you know what you were trying to say, but whether or not you actually said it is the key. You guys may have heard us say this in the past, but the way the scoring works is you need to say it and show it for us to be able to score it. So while many of you are organizations that the foundation has funded for many years and we're deeply familiar with the amazing work you do, there's going to be a team scoring this, and the members of that team may not know your organization. So don't assume that we know it. Put it in your application. Tell us what it is that you do. Give us all the details we need. We want to give you every single point that you're entitled to, but it's got to show up in the application. Let's see. Next slide. So then here's just a couple tips. One, make sure you've looked at the rubric. I just said, have someone score it for you if that's sort of a helpful way to assess if you said everything you need to. Remember, we don't necessarily know you. And then just a reminder, again, we're not looking for fancy words. Just say it in plain language is perfectly fine. Try to get it in early if you can to give yourself more time. And then the call documents, make sure you're super familiar with them, but the FAQs also have a lot of really helpful information. They'll be updated regularly. So as you're preparing your application, really good idea to go back to the FAQs and just see if there's anything there that gives you some insights that would be helpful. And then if you have questions after this webinar that, are still kind of keeping you from submitting your application or giving you the detail you need, please send those questions to the questions at email. We get those responded to in usually less than 2 business days, so you'll get a quick response. And I think that is all. So just a quick tip, remember, say it, show it so we can score it, read the application carefully, and have some fun with it. Like, we're really trying to do some cool stuff for the community. So lean into, just as Abin has said, what you and your experience know really, really helps for your community in terms of mental health supports. And now we are ready for your Q&A. Thanks, everybody.
Thank you, Kim and Abina. We are moving into the Q&A portion of the webinar. And again, use the Zoom Q&A feature to submit questions for the facilitators. That way, if there are repeated questions, we can really make sure to elevate those. And then if you have any technical issues, chat SDF Tech directly. We are going to start off with some questions from the registration for the webinar, and hopefully that may clarify some things ahead of time. But if we don't answer anything, any questions you may have in this portion, again, we will jump right into the Q&A feature. Yeah, so we'll get right into it. So Abina, could you clarify clinical versus non-clinical? Can't hear you.
Abhinav, will you work on that? You want me to take that one? Yeah, great question. So clinical would largely be services by a licensed clinician that could otherwise be billable, the type of things that we typically see in a clinical setting. Therapy by a licensed clinician, medication management, non-clinical are the other side, things that don't require a license, things that happen informally. Non-clinical could be things that happen in our community center, in our communities. Examples could be healing circles, community events that really give people a sense of belonging and purpose. They might not have the title mental health on them, but the effects of those services, interventions really help people feel connected, belonging, and good about themselves. Oh, and Alvin is coming in here, so feel free to say if that does not help and we can provide further examples, but gardening and yoga came up a lot in our community conversations about the non-clinical ways that people get and receive support.
Great, thank you. This might be contextual, but would community health workers be considered non-clinical?
They can live sort of on both sides. And so, sometimes we see them certified billable, other times they are much more in the informal space. So I think for the purposes of this, you could certainly consider them something that we would look at.
Sounds good.
Peer support specialists and community leaders, community elders who are trained in culturally responsive practices.
Great, thank you. Again, just a reminder, it's we can track the questions if you submit them to the Q&A portion. We love the chat. They just tend to get lost in the chat. So please use that Q&A feature at the bottom of your screen. Abna, are there any restrictions on what the funds can be used for, such as events or capital projects, legal services?
So as long as it honors the intent of the call, culturally responsive mental health supports, and aligns with the scope of work provided, yes, we would support that if you make the case.
And similarly, you mentioned that the funds are flexible. Does that mean they could be used for general operating or support that specific program?
A great question. It has to support that specific project as outlined in the grant agreement. So flexible as long as it's addressing the scope of work in the grant agreement, not GOS or general operating supports.
And Kim, is this a funding opportunity for new programs or existing programs?
Good question. It can be for both. But as we said, because it's one-time funding, we would really encourage organizations applying to think what they plan to do after the grant is over, because there are no plans to just immediately continue this. So it can be for either, but we do expect most of the applications would be for existing work where the intent is to strengthen it, expand it, refine it.
Thank you. Abena, there is another open call occurring. You mentioned Healthy Births, Healthy Communities. Can my organization apply for both open calls?
Certainly, the organization can apply for both open calls as long as their proposed project is not the same for culturally responsive mental health supports or Healthy Births, Healthy Communities. And as Kim mentioned, you can submit multiple LOIs.
Thank you. And what is the typical grant amount or kind of the range anticipated for this opportunity?
Oh my gosh, that's always like the $10 million question, right? As Abena mentioned earlier, the range that we'll be making goes anywhere from 50,000 for the whole 2-year period to 250,000 for the whole 2-year period. And the determination about how big the grant is will largely be what you ask for and whether the budget is reflective of what you're planning to do, your organization's size, in other words, the capacity you have to like absorb that grant and do well with it. So we really ask just, it's the classic thing, like make sure the budget is reflective of the work you're going to do, the community need. But that is the range of about 50,000 to 250,000 for the 2-year period.
Mhm,
And
mhm.
we may, as often happens, there may be some adjustments made. But it definitely is best to really submit for what you need.
Great, thank you. I was wondering, we've got some questions regarding historically marginalized community, whether that includes older adults, foster kids, LGBTQ communities, and how does the funding opportunity define historically marginalized?
So all of the above. Um, we recognize that there are certain segments of our population that are marginalized either by gender, race, geography, etc. And so we are open to learning more about who and what you describe as being historically marginalized.
And I'll just add on sort of one like very simple way to think about that is who's left out, who's left behind. A lot of what we're trying to support in this call are for services and supports that many of us might take for granted that are just readily available to us in our communities. But for some of our neighbors, we know that they don't exist, or maybe they exist, but they don't feel welcome there. And so if it's anyone who's left out or left behind, this call is really meant to try to help fill that gap, build that bridge.
So someone that I spoke to a few weekends ago in the community mentioned that older adults are marginalized because they tend to be more isolated. And we also talked about Black men also being marginalized. So
Thank you. Could you all speak to funding smaller nonprofits or using fiscal sponsors?
with the funding opportunity, we have it listed as one of the eligibility criteria that you can use a fiscal sponsor. So we encourage you to use a fiscal sponsor if you think that would most benefit to you.
And smaller organizations, there's nothing that precludes a smaller organization from applying. If it's a very small organization with, say, a very small annual budget, we'll be looking to see whether or not they can absorb the grant and make good use of it. So I would just suggest, or we would suggest, making sure your budget request kind of aligns with really who you are and who you'll be during the grant period. But there is absolutely nothing that limits a small organization.
For newer projects, is it expected or okay for part of the funding to encompass planning periods or planning funds?
Now, our intent is to build on what you're already doing in your community. So you should know your community. You should be a trusted advocate in the community. And so these funds are not for any planning or any assessments. It's for doing, getting on board and doing, expanding on what you're already doing, or testing new approaches at the organization.
And I think that just really speaks to sort of one of the core elements of this call. If you're asking yourself, are we, my organization, well positioned to apply for this? We're really looking for organizations that deeply get their community that they're trying to work, are like already know what community needs, they know assets, they know strengths, and there's a real love for community. And so this is really giving them the fuel to do what they already know needs to be done, It's not about experimentation and testing. We see the worth of that, but this call isn't for that. Essentially, we want the dollars to get to work right away because we know the need is there.
A related question in the chat. The funding cannot be used in part to evaluate an existing or emerging program.
It's really not, again, sort of similar to the question about planning. It's really not to hire an evaluator to see. I think where there might be a little bit of like gray area is, say you're doing something and you're like, this really feels cool. I wonder if we modified it a little teeny bit based on what we've heard from community. You can do that with these funds, but it's not to do a true full-blown evaluation. Those are really important, but that's not what this call's about.
Great, thank you. Some folks are wondering if you all could speak to collaboration in applications or providing services or disbursement of funds from a lead organization. Just kind of general, how does collaboration work in this funding opportunity?
So we leave it to the applicant to determine what collaborations, the partnerships that they want to engage in. So the lead applicant is the only organization that is going to get funding from St. David's Foundation if awarded. And the lead applicant will then work with their collaborative partners based on if an MOU was done between them to decide how the money and then the work would ensue.
But again, just one thing, unlike some of the calls that we've released recently, there's no like special points for collaboration. So we definitely encourage it. But just really think about whether that's sort of working on what the community needs. And I did, while you're looking, I noticed that one of our respondents, asked a little bit more about funding for evaluation. So just to give an example, if the proposal has, say, $50,000 to hire a consultant to do a formal evaluation that would be a written report, that's really not what we're looking for. If what you're talking about is a much more informal, like we are trying some stuff and we really want to bring community input in, and it's a very soft getting community input, that's fine. It's just, we're not looking to use these funds for formal evaluations. We want the funds to go directly to community to make a difference.
Mm-hmm.
Okay. Cool.
Yeah. Kind of going back to non-clinical versus clinical, what about licensed staff working in a non-clinical free community-based organization? Talk about licensing and peer support, community health workers, things of that nature.
Yeah, I think it's just good to acknowledge that there are organizations and services that exist that straddle both clinical and non-clinical or exist in a bit of a gray area. If your organization provides clinical services, whether they're mental health or physical health, that doesn't preclude you for applying. But what this call will fund is not those clinical services. It's the adjunct, the extension into community. And so you can certainly apply if you provide clinical services. It's just that what we fund in this call will not be for those clinical services. And I think, again, think of it as a bridge. We know we've got strong clinical services. We know the community doesn't always, for a variety of reasons, feel that they can easily access or trust those services. In some cases, what we fund in this call, we're hoping will be ways that we can build trust with community, act on what community is saying that it needs and wants, and then ultimately be a bridge to those clinical services.
Mm-hmm. When we talk about well-being support, do we include non-medical indicators and drivers of well-being, such as community building, economic stability? Could you speak to that?
I would say the answer, but Abhina, you can chime in, is yes, yes, and yes.
And if you recall when we talked about the strategic plan pathways to health equity, those goals are intersectional.
Mm-hmm. Is St. David's looking for organizations that primarily serve rural or anything grant specific or county specifics? Yeah, just what are the areas that we serve?
Okay, so we serve a five-county area: Bastrop, Caldwell, Hayes, Travis, and Williamson County. This funding opportunity is open to all eligible organizations within those counties. So not necessarily we are looking for rural is encouraged. We are looking for proposals from urban, suburban, as long as it meets those eligibility requirements and scores high and is awarded, and something that responds to the culturally responsive nature of this. Yes.
And I think just a little thing to add on, as we've said before, we're looking for proposals that really deeply understand who's left out, who's left behind, and where there's not existing resources for that group. So while we don't have like a special requirement for rural, we do know that in rural areas, it's less likely that there will be those community supports. I see a question, Claire, that I can just jump to while you're looking. Someone asked if this can be used for capacity building or salaries. Yes, as long as it is relevant to the work. Again, same reminder, if it's for new salaries, you're going to hire a brand new person, you can certainly do that. Our reminder is just remember that this is one-time funding. And so at the end of the grant, that salary is going to have to be paid, but the grant won't be there to pay for it. But yes, salaries are perfectly fine. So it's capacity building, all in service to what it is that you said you want to do.
There's also another question asking us to repeat counties. Again, it's Bastrop, Caldwell, Hayes, Travis, and Williamson counties.
Are school counselors and school-based organizations eligible?
There's nothing about it that would not make them ineligible, but again, if it's clinical work, if it's a counselor who's providing clinical counseling, that is not what this call's about. If it happens to be a counselor trying to extend into the community, of school or the neighborhood, healing practices, interventions that promote connection and belonging, just because it happens to be done by someone who's licensed doesn't make it ineligible. It's about the activity that's happening.
Mm-hmm.
But if it truly is to provide like counseling that could otherwise be funded by insurance, then that's a clinical service and not eligible.
We have a few questions regarding community spaces and services, whether that applies to physical only spaces or organizations that serve participants virtually.
Both.
Mm-hmm.
One of the things that when we went and talked to community, whether it was in the 3 kind of large community conversations we had or individually, spaces, just as Abin has said, to be able to go and get a sense of connection, belonging, welcoming are super, super important. And it's easy to forget that there's a lot of our neighbors who don't have ready access to those spaces. So whether it's physical or virtual, I think we're open to either.
And the key word is culturally responsive mental health supports. So is it culturally responsive? Is it tailored to the needs and assets with the target population that you are serving?
There's so many great questions. Thank you all. Will SDF release funding opportunities in the future for clinical mental health supports?
Great question. Quick answer, yes. There will be some coming this year, but those are for a very sort of narrow subset of clinical services provided largely by our core safety net providers. But then at the end of this year, you can expect to go on our website and see kind of a roadmap of future funding, which will definitely include clinical services, including mental health, maternal health. So yeah, a lot of what we're hoping to do in this call is really surface some of what we don't know exists, some huge assets that are happening by organizations like yours, that as we expand clinical, we really want to be able to connect those two where it makes sense for the community. So yes, clinical will be coming.
Could you define what is meant by provider here? It sounds like we don't mean social worker or other mental health care provider.
Yeah, provided's tricky, right? Like when we say provider, we just mean the person who's doing the work that you're proposing. It doesn't necessarily have the very specific definition when we hear provider of an MD, a nurse, a social worker. It's whoever's doing the work.
As long as it's culturally responsive and responds to the community's needs, assets, and context.
Great, thank you. Can we include culturally responsive training in our proposal?
Yeah. Yeah.
Some folks are wondering if you could speak to evaluations, reporting, the biannual cohorts, kind of what that might look like.
Yeah, there will be some reports, as Alvin has said, our intent is to make sure those aren't overly onerous or overly frequent. So there won't be a huge investment of applicants' time to fill out their reports, but we do want them for our learning. We also expect that there'll be some cohort convenings. It might be in person, it might be virtual. Some of that will be directed by us, of it probably maybe at least one, but a lot of it we're hoping is directed by the applicants themselves, of saying how they want to connect with each other in service to their work.
We want to learn what is working in your community, and how can the foundation shine a spotlight on what is working for our community.
And like, why? What's the magic sauce? When something works, why did it work? Like, what was the intervention with, like, what was the relationship with community? So a lot of this stuff is, I think, things that the people on this call, you all know instinctively, but doesn't always show up in the way philanthropy funds. So we're hoping to learn ourselves to make our other funding opportunities more responsive to what your communities need.
Great. Can funds be used for direct services or wraparound services to help clients?
I'm nodding and then I'm looking at Abida like, is that okay? Yes.
So what do they mean by direct services? I'm just curious. Yes. I'm just
There's nothing specific mentioned, but I would
Direct
guess
services.
wraparound.
I'm relating to you. We're doing, like we're having, I'm just making up stuff here. We're having a Saturday session where people can come and share stories, do work on behalf of the community to give them a sense of purpose. That's a direct service. And yes, that is absolutely eligible.
Mhm.
And then we saw here, there's a question about housing for participants who are homeless. That's not, it's outside of the bounds of the call.
Are we looking for a certain number of people served by programs or services?
You tell us. You tell us. We really want to know whether the intervention or program that you delivered really worked. What can we learn from that process? How can we share it? How can it be scaled?
But there's not a specific, like, we want to see at least X number. To Avina's point, we'd like you to tell us what type of impact your proposal is expected to have.
The key word is, high quality, culturally responsive mental health supports. So there's a question about gift cards, HEB. I need more context in terms of what is the engagement in community? What does it look like? Is it providing, the non-clinical mental health support? So I'll need more context before I can fully answer that question.
Yeah, but I think the specific answer is there's nothing that would say absolutely you can't do it or absolutely you should. It's really about how it fits with your proposal. One bit, I mean, here we're really looking for things that the community is saying that they want and need. So, like in some cases, we use gift cards because we're trying to get people to do something that maybe they don't necessarily want to do. I'm not saying they're not allowed, but really think about like, are you responding to what community really wants and needs?
If an organization would like to bring their program into our 5 county service area, would they be eligible?
So again, this funding opportunity is for organizations already doing this work in our service area. And so the question about bringing something externally as an organization and implanting it here in Central Texas without knowing the community's context, that's what we are looking for.
And then we'll do one last one, being mindful of the time. We have multiple strategies in addressing mental health in the community connected to community initiatives. Should we apply individually or show the collectiveness of our overall vision?
Great question. I think we would love to see what your overall vision is and how a specific funding opportunity, whether it's this or something else, actually helps advance your other goal. I mean, we're very sensitive to the fact that, these things are all interdependent and you advance one goal and you make the other goals more likely. So yeah, showing your thinking, I think we would welcome that.
Yes. We are at time. It is 11, and so we are going to wrap up the webinar. But please reach out if you have questions to questions at stdavidsfoundation.org if they're programmatic related. If you have technical questions that are related to the application, budget, 990, all of those nuts and bolts, please reach out to grantsinfo@stdavidsfoundation.org. Most importantly, thank you for your time this morning, but thank you for the work that you do in our community. It is invaluable, and we are grateful to be a part of it in one form or fashion. This webinar will be recorded and it will be sent out about next week. That's the goal. So again, thank you all. Have a great rest of your week. And we appreciate your time and your work.
Thank you. Thank you all.